Good morning, and thank you so much for joining OAESV with our critical conversations in reference to the VOCA cuts in the state of Ohio. Today, we have the distinct honor of having Kristin Shrimplin with us from Women Helping Women, and she represents part of the Southwest region of the state of Ohio. And we are so happy that you're with us today, as well as Camille Crary, is our Director of Public Policy. And VOCA continues to impact them distinctively. Even if time has passed, it's been a month since we received notification of the grant. And also it's been a year that we've known that some cuts will actually happen. But Kristin, tell us a little bit more about you, your agency, and the dual facet of Women Helping Women as an agency.
Yeah, I'm happy to. And thank you so much for having me this morning. So Women Helping Women, our agency's mission is to prevent gender-based violence and to empower all survivors. So as you know, when we say gender-based violence, it's an umbrella term that's really focusing on dating violence, intimate partner violence, sexual violence, and stalking. So we are what is known as a dual agency, a rape crisis center, as well as an agency that responds to and tries to prevent intimate partner violence, domestic violence, dating violence. We've been around actually last month, we celebrated about 46 years. We grew out of a movement back in 1973, where there were some students actually at the University of Cincinnati who were really upset about sexual assaults and rapes in our community, and the fact that our community had no infrastructure of response, specifically and mostly to women who were sharing the load and carrying the burden of experiencing violations of their bodies and mind and spirits. And so they came together first as a volunteer agency. And then when they got about 5 people together, they literally found a room in a building with a phone jack, and they plugged a phone into that phone jack. And that is what started our hotline. And so it was volunteers from the beginning, just average everyday people coming together and saying, this is enough. They started a hotline. And that hotline has grown, and those few volunteers has grown to where we are at now. We serve 4 counties, Hamilton County, Butler County, Brown, and Adams County. So we have both an urban and a rural footprint that's very important to us. We served the most survivors as a dual agency in the 4-county region last year, around 8,600 survivors. This year, and we'll talk more about that later, we're at record-setting paces. Last year was a record year of how many folks we served. And then when we really focus on our mission, we have our intervention core services, and then we have our prevention core services. And so on the prevention end, we focus very strongly using evidence-based curriculum. And how can our young people really have relationships that are based in equality and free from sexual violence, sexual coercion, and abusive characteristics. So, it looks a little bit different now with COVID, but traditionally we are in about 23 different schools, serving 5 to 10 sessions per school. So we serve quite a few young people that way. We also work in a sexual violence prevention, very targeted focus. Again, looks different with COVID. But a couple of years ago, we started a responsive program to what we were seeing in the community with bars around sexual violence. So we've partnered with bars around prevention. What does it mean to really be a upstander in our community? And bars have been incredible in Greater Cincinnati in joining that program. And then we also do prevention work within the workforces, corporate spaces, community spaces, and then intervention I believe we right now are up to responding to 25 hospitals. And so we have 24/7 units with that. We'll talk more about that later too, and some of the things that we're really concerned about at the agency,
Mhm.
of where we're feeling a lot of pain with loss of funding. But 24 hours at 25 hospitals, whether it's a sexual assault survivor, or I believe it was about a year and a half ago, we also started including domestic violence survivors. If they presented, we would run out. We respond to the courts, we respond, and we are located on Miami University. So we can serve survivors there, whether it's faculty or staff or students, as well as the University of Cincinnati. We are housed there. We're housed co-located at Legal Aid, because a lot of our clients really, 92% of them live in extreme poverty. So we have to partner and connect them to additional resources that are free for them. We partner with the prosecutor's office at the city level. And then our hotline 24/7. And then in COVID, we started a 24/7 text chat as perhaps a safer way for people to communicate if they're in a shutdown situation. As well as 3 years ago, we started a 24-hour response. Now, this is just for domestic violence. However, we know very well that sexual assault and sexual violence is such a horrific tactic of abusers.
Mhm.
So we started a 24-hour response team when the police go out on a domestic violence call. We are dispatched. We have police radios. We go out on scene. And we can talk more about that later as well, with the uptick that we're seeing around sexual violence among our survivors.
Thank you. So there's a common theme this year, right? And it's the impact of COVID, especially with survivors of sexual violence. But and things have changed in the way that we do advocacy, whether it is tele-advocacy or creating the chat. What can you tell us about how have you seen the impact of COVID in those regions that Women Helping Women actually serves? From a rural perspective, as well as seeing it from the urban
Yeah.
and direct. Did it stop? Has it stopped?
No, it hasn't stopped. It's horrific. Sexual violence, and we've been clear about this in our movement. This is a public health epidemic,
Mm-hmm.
always has been. And so what we, as well as all of rape crisis centers in the state of Ohio and across the nation, are grappling with is, how do we deal with a public health epidemic that already exists? And specifically we think about, and this is why we're in the schools, and this is why we work really hard to respond to survivors, and specifically also why we launched a couple of years ago our campus outreach. When you have 1 out of 4 teens, 1 out of 4 girls before the age of 18 already experiencing sexual violence before they even get a chance to really start their young adult lives, right? To emerge as students, to emerge as leaders, to grow into their role in the community, to grow into their role in their family and their relationships. The fact that they've already experienced a public health epidemic. So in COVID, trying to deal with sexual violence, gender-based violence as well, public health epidemic, a pandemic hits, and then all along, at that baseline, disrupting everything is structural racism. So literally 2020, while structural racism is not new, public health epidemic of gender-based violence and sexual violence is not new. And we were already grappling with that. Pandemic was new. So we can't claim structural racism or sexual violence is a surprise, but the pandemic certainly was.
Mm-hmm.
And it has greatly compromised, it has greatly compromised the work we're able to do in our region. When I say our work, I mean our collective work of any system, whether it's in the rural communities or in our more urban footprint, as well as our agency. And the greatest cause of alarm that we have is, what is the on the ground impact for survivors? So when we know that if you live in Adams County, you are already struggling with having to travel 3 times as far to get connected to a support system. So that's just a basic fact of life by living in a rural footprint. But now, how are you doing that during COVID, when economic resources are really, really limited?
Mm-hmm.
You're already struggling with poverty. The resources you're trying to get to are already struggling and compromised, whether it's a very rural medical system, whether it's a court system that's trying to navigate how they are now, months ago went into a red alert. And all of this is very new for them, at that point. Or whether you're in the urban area of Hamilton County, Cincinnati, in our footprint, in that part of the county, in that part of the state, we've been red for a while and very concerned about going to magenta at the highest level. We've had to, and this is where we've been very concerned with survivors. So we've taken an 8-month snapshot of data. So just at our agency. And so this is what it tells us during COVID in 8 months. We've had a consistent surge of overall survivors, about 23%. Sometimes it's 23, sometimes 25, sometimes 22, but really it's going like this, just more survivors. Now, while it's doing that, what we know is during that 8-month span, at times hospitals were limiting access to survivors.
Mm-hmm.
And we understand that from a public health, trying to navigate COVID. I'm very concerned about, is that what we're going to be seeing in the future here soon again? Our court systems for a while were temporarily halted. Now, police units didn't tap down their response, but it looked different. And then when we started having, again, structural racism's always been here. But, when Mr. Lloyd was murdered, May 25th, May 26th, survivors then also started to carry that burden of concern and worry around trying to make a decision. Is this going to help or hurt when I reach out to law enforcement?
Mm-hmm.
So a lot of these things started, really, it was like a perfect storm. It was like a tsunami coming together. So while we've seen that, consistent 23% increase, when we look at our hotline, now in the early stages, in the beginning, mid-March to early April, sharp decline. That's why we started the text to chat. And it's because we were having the shelter in place. More folks were at home. If they were in abusive relationships or in relationships where, they were now in a shutdown situation, they didn't feel, and it was a reality where they could call the hotline. They didn't have freedom. They didn't have a confidential space. And then many of our survivors told us it was difficult to even call the hotline because they had to make a decision now that they were losing their jobs very quickly. A lot of survivors we serve have less than minimum wage, but less than $15 an hour jobs. So they were losing those who had jobs. And so they were having to make decisions. Do I want to take up my phone minute times, to make a hotline call? So we started up to text to chat. So we've seen that grow. Now over the 8 months snapshot, our hotline is coming in steady at a 53% growth. That's an anomaly that is called COVID. Then we dip in and we look even closer. What is happening with sexual assault survivors going to the hospitals? That's declined. So of course, we know sexual violence is still going on, and we are talking to our survivors who, reach out to us through the hotline. And so we know that is spiking, but we know that some of those structural areas of where they would normally go to for support, they either have chosen not to go because it's incredibly scary. If we think back to March, April, and May, everything we were seeing on the news, when you saw a hospital, you saw people in these white hazmat suits.
There was a fear factor, and there continues to be a fear factor. I mean, even as we see the numbers increase daily here.
And the other thing we're really concerned about, so as I mentioned before, one of the reasons why I'm really glad we are a dual agency is because even if something pings on our radar as domestic violence, when we show up and work with that survivor, they are absolutely experiencing sexual violence. And if we weren't skilled in that area, our level of support and empowerment would be very limited just to trying to put them in a box of, no, was there a physical injury related to by the Ohio Revised Code definition of domestic violence? That's not helpful to anyone. So what we're really alarmed about is when we go on scene with police, so it gets pinged as domestic violence. We show up and we see sexual violence is present when survivors speaking to us. Specifically in the Cincinnati footprint, we have seen an uptick during COVID of, it's about 15% of when we show up, when we look at what was happening in February and then what's happening now, there's a 15% increase of survivors experiencing strangulation, which equates to, when we go on scene, 55% of all survivors are experiencing strangulation. There's an uptick of 14% when we show up on scene where they've already been harmed by a weapon. So the types of injuries we're seeing are increasing. There's a huge uptick of what we're seeing at the end of the day of what we're trying to prevent. Survivors in the privacy of their own home or their apartment or wherever they're at in the relationships they're dealing with, they're experiencing sexual abuse, sexual coercion, sabotage of their reproductive health care, physical violence. And where we've been ringing the alarm bell is in Cincinnati alone, we are on trend for the most female homicides in 20 years. So Rosa, about 3 weeks ago, you spoke on a meeting, and then maybe it was even one of these Facebook Live situation, opportunities where our movement is going back 20 years. Now, part of that is, we'll talk about that, later, because of the, it's getting pushed that way because of funding cuts. But when you have cuts happening, right? So funding's going down, need is going up, and lethality and danger is going up in violation of human beings. Now, we don't serve children. We're not a child abuse agency. But we also have concerns about that with so much of when there's less eyes on our kids in the community because of schools and COVID.
Absolutely. Thank you, Kristin. And I wanted to back up briefly, and you referenced at the beginning something that really spoke to me, which was the beginning of your agency was start volunteers who saw a need and found a phone jack in an office and started taking. And that really speaks to the spirit of advocacy and knowledge that you have, that Rosa has, that even though there are cuts, we are not going to stop providing services. And I'm wondering if you can speak to what that means for your team and their health and their safety and the well-being of your agency and the people that are providing services, as well as the well-being of the people who are being served, as the resources and coverage are being cut, but that demand is so heavily increasing.
It's difficult. So, thank you for bringing that up, because I'm very well aware of what is saving this agency right now is grit and its resilience of the humans who choose to work here and volunteer here. There's something very palatable in our movement that's been there for, decades and decades and decades, right? Black women, Black queer women, so many started this movement, and it wasn't like this professionalized movement which had all this government funding, but there was a strong backbone and commitment of connectivity, of community, of advocacy, of comfort and support and empowerment, and really making sure of how do we disrupt this onslaught of complete disregard for one's autonomy of self, right? When another human being makes that choice, and it is a choice, right, to violate someone else. And so it's always been, sexual violence has always been here since the beginning of time.
Mhm.
And it's not just, women who are in the movement, but it has been women, right? And women of color, no matter how history wants to write them out, or how current day agencies, right, may want to write them out. It's been started by so many strong women. And so when you have that legacy, so for instance, when you get a job or you volunteer at Women Helping Women, yes, you know what the job description is. Yes, you know what the role and function of the service delivery is. But most people tend to come to us, not just because they're shopping around for any old way to spend 40 plus hours a week. It's because they have that spirit and they have that connection, or they have that experience. And so this movement, and when I say the movement's getting pushed back 20 years, that doesn't mean that nationally our movement, or statewide our movement, or regionally our movement, that any of us are gonna lie back in our seats or lie back on the ground and be like, okay. It just builds more grit and more resilience because of those who started this movement, and we know what they got through. Surely we can get through this. But this has been a systematic deregulation, defunding, and dismantling for years of our movement. And it's kind of now hitting this perfect storm while we have that pandemic.
Mhm.
And so that has been incredibly difficult. But I think it goes back to every single agency in our state asking ourselves, when we have a survivor's agenda, right? The Me Too movement's very clear about this. And when you put out a survivor agenda, survivor should be in the center of every policy decision, partnership decision, program decision. So no matter what that external climate is, no matter how dysfunctional or how much it tries to dismantle, or how chaotic or volatile, if your agency and your movement has survivor in the middle, we will navigate this in ways that are in line with the core values of being survivors and serving survivors. So for us, what does that look like in a concrete example to agency? Yeah, we've lost $650,000 this year. Immediately we lost about $330,000 from fundraising, gone. no CARES Act funding or other pieces of funding agreed to replace that lost revenue, right? And okay, but it's gone. Then we get the Victims of Crime Act cut, which we knew was coming, but we did not anticipate that much. So that for us, that was about $320,000 plus. It's about a 36% funding cut. So as an agency, we could clearly say, okay, we got to shore this up. We have to let staff go. But that doesn't go back to our core values of serving. You know, if the survivor agenda is real, and it is,
Mhm.
and if survivor goes in the center and not marginalized, which has been part of the plan from external forces, when you rewrite Title IX guidelines, when you don't reauthorize an act that's actually called Violence Against Women Act, when you don't close loopholes of access to firearms by abusers, when VOCA doesn't get more in its revenue stream by successful prosecution and settlements of white collar crime, and then that gets reallocated to victim service agencies, that's not putting the survivor in the middle. When policies and regulations are written to take out protections for immigrants, tribal nations, tribal survivors, Appalachian survivors, Black and Brown survivors, LGBTQ survivors, survivors with disabilities, it's already taking those that we have marginalized and placing them on the margin. So at our agency, we had to take a deep breath and not react, not overreact to a $320,000 cut on top of a $330 cut, which gives us a $650,000 loss. We're only a $2.4 million agency. We have no endowment,
Mhm.
but we have values. We understand our who started us. We understand the movement. So we absolutely let go of no staff, because you can't, when the need is when survivors are coming in like this, you can't let go of staff. But we did, to be honest, we did have to, right? You have to balance a budget. So what we did have to stop, we felt it's harder to let go of staff because it doesn't meet the needs of the survivor agenda. So we thought, what do we have to zero out that we can start up again easily with the flip of a switch, provided we shop around to private donors and say, this matters. So it's hard to hear what we stopped, right? What we zeroed out. But I want people to keep in mind, it's because we have a strategy to get diversified support for. But our client assistance, zeroed out. That's a problem. 92%.
Tell us a little bit more about what client assistance actually
Yeah,
is.
for us, client assistance is financial assistance that is needed immediately for safety. And so safety, defined by either relocation in a way like a new apartment and needing a down, putting down a security deposit, or staying in an apartment and not getting evicted. It means we historically, we get movers and moving vans quite often, storage units quite often, and we pay for those. Survivors, 92% of our survivors are 200% below poverty. Over 70% of them have zero income. So they're just trying to keep the lights on. That's another thing we provide client assistance for, as they're trying to go through the process. Maybe we were called to the hospital. We were there 4 to 6 hours with them as they go through the process of an exam. And then they want to perhaps pursue some things within a court process, or if they don't want that, maybe they're just trying to see what their next steps are of just how to get up every single day. And so they're engaging with us as in a support group. And as we work with them, we realize not only did they just get this horrific trauma, they can't keep the lights on in their apartment. So then how do we broaden that context of what safety looks like for their healing process? Well, one is fundamental needs. You get your lights kept on. So we pay a lot around Duke energy. We also have worked with, relocation if they need to go completely to a different place. That's not unusual for us. Even plane tickets, not unusual. Bus tickets, not unusual. Or with COVID, the way a lot of this has looked, there is no, I feel horrible for domestic violence shelters, right? So all of those doors are really just now closed and it's for apartments. But sexual assault survivors, and this is a problem as I may personally see it, we've had plenty of times that sexual assault survivors need access to a shelter for safety. And so that's never really been an option. So we've always put sexual assault survivors in hotels. And so like those client assistance goes to paying for hotels. And then we are very, if I'm not going to go stay in that hotel, why would I ask a survivor to? So we're not finding, dangerous, suspect hotels where, we want people to be comfortable and safe for themselves, their kids. So it's part of those client assistance, or it may be, and this is the way COVID has really looked. I'm sure all of you are aware around the state, Cincinnati's not, in our rural areas aren't new to it. So many of our survivors already struggled with food security. And then COVID just exasperated that. So yesterday I went to Kroger's. I bought $2,000 worth of Kroger's food cards. And we have to buy them at $2,000 at a time, dollars at a time, because Kroger's won't let you do more than that. So we're buying $20,000 worth of cards right now before our new budget kicks in, because we do have some, our county CARES funding is allowing for that triaging that way. So for us, we have to, the agency did absorb a lot of the loss of VOCA so that we could keep our staff, but we had to zero out client assistance because we do feel we can go very specifically to donors and say, here's the situation. Even if someone's chipping in $10, right, that's going to add up. We also, I'm very upset about this, but there was no way around it financially. We've had to effectively now end our therapy services. I was really proud that we started that a couple of years ago, because especially for our sexual assault survivors, we may, show up in their lives at the moment of, right after the moment of trauma. But then there's a long path there. And we had found really great partnerships with contract therapists who specialize in very specific trauma-informed therapy, dialectical therapy, and different forms of therapy that were really specific to the markers of experiencing sexual violence. And so when we started that up, it felt great that it was seamless, right? We already had survivors, and then we brought in our therapy. So in-house, you didn't have to pay. You didn't have to do all this intake. There was no insurance involved. You didn't have to travel. You were already, here connected with us. Oh, hey, we're going to walk you down 2 doors down. And here's the therapist. She's fantastic. We were able to create therapy rooms that were really comforting. So that's, and what we found was that the need for that skyrocketed. At one point, we had like a 6 weeks wait list, because as we started telling the community, hey, we have this, survivors are like, I need this. So that's very painful. And by the way, we offer those services. in 3 of our county locations in-house. So we had it out in Adams County. It was so critical for rural survivors. We had it in Butler County, which was really critical because that's also kind of rural and kind of a higher population density. And then we had it in Cincinnati. So that we had to zero out. We also had to make the decision not to let go of staff, but not to fill. We had a currently vacant position, which was a advocate position at Miami University. We do still have one there. So it's having to do more with less. All staff training, professional development, zeroed out. The ability when we look at next year, we've asked our advocates and anyone who's connected to our agency to work harder. Their paycheck will not reflect that next year. That's tough. So those are some of the pieces we've had to, by placing, survivor in the center of our decisions. Getting rid of therapy, it feels awful, but what we did on the back end was really make sure we understand our partnerships of referrals and make them very strong, warm referrals. And of course, we still continue, we continue our support groups, but those aren't really therapeutic in nature, but they can also help that process. And then we are hopeful when we close out this year and go into next year, the more we communicate to our community, we need client assistant funds we can secure. Last year we gave, I think last year it was like around $60,000 of client assistance that we were able to make a pathway to survivors to receive. And then we know this year, like that only increased because of COVID. So we will feel, and survivors will feel that loss.
Definitely. So in the Southwest regions, there's a total of 8 rape crisis centers, and 5 of them are actual dual agency, right? So when we look at the impact of those VOCA cuts, it actually varies between a 23% to a 47.5% for any particular program. But for the region in itself, it equates to 47% of cuts from VOCA. So it's heavy. It's very heavy. And when you have to make those decisions, right? And thinking about, we're not going to go ahead and let staff go, but the program in itself, the programmatic, the way that we deliver service has been cut.
Yep.
And you did talk at the beginning in reference to, as a movement, we continue, and the people that work in the movement in your agency, grit and resiliency. But people are stretched thin. Yeah. Completely, right? And it continues to be, this continues to look like a grassroots movement.
Yeah.
And even being as a movement, when we talk about going back to those 20 years, we're talking about that in the sense of the programmatic that needs to be cut. We're unable to do this in the holistic way and in a survivor-centered way, because we're dictaminating what services can we provide the contingent on the fundings that we receive, right? So healing looks different for survivors. For some, it might be 10 sessions of therapy. For others, they might not come after 10, 15 years and still need those services. It might be candlelighting or art, right? Art therapy. It might be a walk in the park. It might be that continuous ability to call that hotline and speak with a live person to mitigate those feelings or the trauma that a particular day event. We're having the holidays coming up right now. And those that don't understand necessarily the dynamics of trauma for gender-based violence survivors, holidays are terrible. seasons. And all of our agencies will see a peak in the needs, in the calls, because it evokes feelings. And then you have the fact of either staying at home or not being able to be with your relatives, whichever ones you want to be, or being in a financial strain and unable to actually go ahead and provide for your family the way that you need to. And the agencies, all of our agencies, are limited in the resources that they are able to provide now for the community, because we're going back to the core, just the core, the basic, for sustainability purposes.
You're absolutely correct about that. And the problem, there's so many problems with all of this, but as I said, we've got this, 8 months is not one quick snapshot, right? You've got a surge that is not letting up of more survivors manifesting during a time when all systems are compromised. And so we're really worried about like November, this month in December, and what that surge looks like and what more compromised systems look like because of COVID. But not only with the funding cuts, and then we have to like put the light switch off with therapy, client assistance, but then we maintain staff at their current level, and then that surge goes. The problem in addition to that is all good strategy tells us last year we had our record numbers of survivors served. The year before that, record numbers survivors served. The year before that. So we know our trend, right? In the past 2 years, we've had a 55% growth of more survivors. The agency's not grown 55% of more advocates or programs or responses. So if there were no funding cuts, if there was no pandemic, we knew this year, and specifically next year, we needed to add advocates because of need and relief. We're not making widgets. No one in this movement is making widgets. We are walking a path with humans who've been violated, and what their path towards healing, if what in healing's a loaded word, but that path differs for everyone, has a different time process for everyone. For some, it's a one and done emergency response, and for others, it's a continuation. So everything told us we needed 5 more advocates this year. Hiring freeze immediately happened March 16th. So it's not just that we didn't lose staff this year, we didn't add staff, so we kind of did lose staff, right? When you think about it that way. Next year, we can't add any staff. So we've had a surge, more survivors. Next year, we'll have more survivors. Pandemic's still here. Public health of gender-based violence still here. Structural racism really still here. And so my concern is, and when we dial in, and so our agency got together, had all the directors present in a 3-hour session, all of their data and all of the trends of their data. And we mapped it on every single service delivery. And then in real time, how much is our staff doing around all of that data so that we could understand what are the needs of our community? What are the needs of our agency? And I don't think we're any different than most agencies in rape crisis movement. We're understaffed, we're overextended. And one area that's our Achilles heel, when we look in Butler County, which is rural, but it also has some higher population density. We have 7 hospitals out there that we respond to. Miami University is also out there. So when we look at our rape crisis core services, we have a team, a very small team based in Butler County. We have a very small office based in Butler County. Those team members are on call for 24-hour shifts. That's not the way our team operates in Hamilton County because we have many more team members. And we have a much larger volunteer base that provides us that relief. Now we have great team members in Butler County, smaller amount. We have great volunteers in Butler County, smaller amount. We have 7 hospitals to respond to 24/7. We have an Achilles heel issue. We can't keep doing it. It's not equitable to our staff. It's not sustainable to them. It's vicarious trauma without relief. So what we're trying to focus on now, and it's a long shot, but we have to try when funding's going away. We realize we need to stand up a whole new unit in Butler County of what we call a 3rd tier response for after hours to go to the hospitals. So we have that in Hamilton County. That way our daytime staff get to focus during the daytime and they're not going out all hours of the night and they don't have to be on call all the time. So there's relief for them. We need that in Butler County. So we've identified in order to meet the need, and there's a rising need of sexual assault that needs responded to in those 7 hospitals. We're trying to put together a program where it means hiring this 3rd tier of advocates who go out, they handle the hotline, and they go out to the 7 hospitals so our staff daytime don't have to do 24-hour shifts of being on call, can get relief, because we have high turnover on that team. And it's no wonder why. We have excellent advocates, but high turnover. And that's not sustainable for our movement. And so that's also heartbreaking that, as an agency, you have to be very mindful when you ask people to serve. The folks who come to us, as volunteers and as employees, they always say yes. Because everyone says for the good of the community and good of survivors, but as agency leaders, we have to look at what is good, the good of and good for our staff and volunteers. And that is the painful reality we're in right now. In order to protect the mental health and the physical health. At one time, we had 50% of our advocates in quarantine in COVID. So in order to protect the health of our talent at the agency, that means at times we cannot fundamentally respond to every survivor data point who reaches out. We already know we're not responding to all survivors. I think like in Hamilton County alone, if you look at reports and you look at what we get, it's 15%, right? You have a public health epidemic. We know we serve 8,600 survivors total. That includes all types of survivors. It's just a little bit. But we serve 100% of those 8,600, right? When they reach out, we respond. It's very difficult right now to figure out how do we protect the health, the holistic health of our staff. They did amazing. They did amazing in what we asked of them. We all thought it was short term. We're now at 8 months. We're gonna up this surge, with COVID. COVID's not going away the rest of this year. Staff knows what is asked of them. Volunteers, our volunteers are amazing. Our whole text chat, it requires 52 shifts per week, just for perspective. Right now, we're transitioning that all volunteer driven. So they're amazing. But when we hit 2021, difficult decisions, whether it's us or any of our other rape crisis partners, we can't keep asking the same of our people.
Of course. So Kristin, as we're getting ready to wrap up, you mentioned 8,600 people served last year. Or this year, actually, the midst of this year. What were your numbers in 2019 in comparison? And I know we're going all the time higher and higher. And also, if you had an opportunity to speak with your community and your politicians and legislators, and now for them to hear you, what would you like them to know? What do you need the community to do in order to also be survivor-centered and to respond to an organization that has over 45 years in existence in making huge strive for survivors of gender-based violence in the Southwest region?
Yeah, I appreciate that question. So last year was the 8,600 that we served. So this year, we know we're on trend for even more. And so what my ask would be, or point of advocacy, whether it's an elected official, policymaker, funder, that informal leader, in any community. This is not a niche issue, all right? Sexual violence, gender-based violence, this is not some issue that only impacts a certain person or a certain type of person or a small percentage of people. This is a quantifiable, decades on end, public health epidemic. So the only good news I see with COVID is I think mainstream now, any person right now understands the word public health epidemic. This is suddenly a new phrase that a kid in school is learning right now. Like, people know the terminology now. So previously, when we would go to elected officials or we would go to policymakers or funders and say there's a public health epidemic, we really had to work at it for people to understand that. So we don't have that hurdle anymore. So what I would make really clear is everyone understands what a public health epidemic looks like. It's alive and well here with sexual violence and gender-based violence. The good news is there's a public health solution. There's a framework to this. And that's where I get really excited to talk to elected officials, because there's 6 layers of levers to pull. You can pick your layer. And depending on where you're at in the community, you have a different entry point to that. And why should people want to be part of that public health solution? Because sexual violence and gender-based violence impacts us all. It's an economic issue. It's a healthcare issue. It's an education issue. It's really a workforce issue. And it goes beyond, but this also matters, but it goes beyond the sentiment of it's the right thing to do. But it is the right thing to do. Anyone who's ever loved anyone and has had to, had the privilege of that person to share, and, and that survivor shares with them their truth on a day or a time or multiple times where their lives changed. Anyone who's ever been in that position, you know how important it is when you give the data points. So when we say things like 1 out of 4 girls before the age of 18, behind those data points are little girls, are teenagers, our daughters, our friends' daughters, our nieces, our granddaughters, our sisters. And it also impacts boys and men. And so I think what I would really try to encourage leaders is fact, public health epidemic. You have something you can do about it, whether it's through policy, law, regulation, funding, support, volunteering, education, prevention, or on the other end, the moment someone discloses to you, tell them, I believe you. It's not your fault. I am so sorry. What would you like to see happen now? and then empowering. You got to give that instant empowerment back to a survivor. So I think there's so much room to have empathy and activation. There's so much room for that. And I have literally, I've only been at the agency about 5.5 years. I've been in the movement 20 years. I've been in Cincinnati like 15, 16 years. I have to tell you, I get asked to, pre-COVID, I get asked to coffee a lot. I love coffee. I love talking to people. I've been on the media a lot. I collaborate a lot with a lot of folks as a function of my job, which I'm grateful for. I literally have never met anyone, specifically for the past 5.5 years, who has met with me talking about agency business, and he says, I don't know what you're talking about. I don't know anyone. I've literally almost every media, and I love working with the media because I love the reporters and the camera people. I think they're fantastic, that they're willing to get the message out there. There's always the conversation before and after, and their personal conversations. I take it back. There was one person I met in an elected office at the state years ago. It was 2015 in the fall, came to our agency and wanted to know if rape was new. And we informed her, no, it's not. And she said, well, I just don't know anyone who's experienced that. And I said, okay, we can meet you where you're at. But in the room right now are 20 people, and we all have.
Mm-hmm.
And so that kind of helps bridge the gap. If there are people out there who don't understand this issue or, have never experienced it, okay, we can still bridge that gap. But I mean, I've even worked with CEOs who understand, of a corporation and are like, oh no, we get this from a bottom line productivity, economics issue.
Mm-hmm.
And so that's how we talk to them. And then they always stop me in the meeting and they said, but Kristin, come on. This is also about doing the right thing. So I appreciate that. You always can get surprised by who champions are. And if you let me talk, I'm going to keep going. So you're going to need to wrap me up because I've had a lot of coffee this week.
And we appreciate that. Camille, from a policy perspective and from a statewide perspective, what can we continue to do to amplify the voices and the needs of survivors within the state of Ohio and the urgent need of our agencies across the spectrum, so that they understand that we need to continue to fund VOCA in a very sustainable way. A $55 million cut for our state is not acceptable.
Absolutely not. And I really hate following Kristin right now because you did such a beautiful job. So thank you. And as you were speaking, you referenced multiple times that the term public health crisis is now part of our regular discourse across Ohio, across the country. And I think it's important to remind lawmakers that COVID, a very supportive lawmaker, Representative Laura Lanise, said in one of our advocacy days at the very beginning of COVID, there is life outside of COVID. And we have to remember when we're governing that there are things that are always going to be happening outside of COVID. Now, COVID has totally exacerbated this situation, but we have one public health crisis, COVID, that we have to wait for the FDA. We have to wait for vaccines. We have to wait for a number of things to happen before we can fully address and end that. This is a public health crisis we know how to stop and we know how to address, and we have the tools to do that. So we need to leave those tools where they are and keep them available to the people in our communities. And that's the message that we need to send, is that we know how to address this. We have a long battle ahead of us. Obviously, sexual violence has been around as long as human beings have been around. So let's not take those tools. Let's not take that progress away. We need to keep moving forward. And as Kristin said, I don't relish this part of the argument, but there is a fiscal cost to the state for every victimization that happens. There is a loss of productivity. There's an individual loss that's huge. There's also a quantitative statewide economic loss as well. And so, that is a perspective that I've never once had to rely on at the State House, thankfully, to the credit of our state lawmakers. But it does come up, and it is important when we're talking about multiple layers of public health crises. We've got 3 at least going on right now, probably more to come in the days that, or the months that follow with COVID. But this is one that we can demonstrate, okay, this is a way you can salvage some economic benefit or some economic piece of this and justify it that way as we grow with economic needs. But we are in a different position than we were 2 weeks ago, last week, in that we know who our state lawmakers are. We know who our federal congressional representatives are. I think we're in a really good position because at the federal level, at least, all of our lawmakers are incumbents. And so this will not be new information to any of the lawmakers representing districts in the state of Ohio. So we are at a point now where we can build on the relationships we have. So the federal budget process starts in the spring. The president's budget comes out first, and then much like at the State House, the representatives and the senators have hearings, they pick it apart, they put it back together. So legislators have a lot of pull. And what we need to be doing is meeting with them now. And there are the basic asks: prosecute white collar crime fully, make sure that that money is getting deposited into the Crime Victims Fund instead of the general fund when it is prosecuted. Increase the amount of money that you're releasing to states. Waive the match requirements. For those of you that aren't aware, the VOCA grant requires an in-kind donation match for every $1 or volunteer hours. Right now, that's really, really hard because the economy is in trepidatious territory, and people can't come to volunteer events. They can't come to fundraisers. We're in a different environment. So we need to give them the whole picture of what survivors need. That is so important because we know the world is in a difficult place right now. But if we don't tell lawmakers what the real fiscal needs are for our agencies, they can't make educated decisions about how to offset the various needs that are being brought to their attention. So we will be providing, now that we have the list of lawmakers for sure, at both the state level and the federal level, we will be providing links to how to find that. We're working directly with our members on reaching out and setting up tours, virtual tours for the most part, of programs with lawmakers so that they understand what's at stake, because we have an opportunity in the next federal budget to increase. Now, I think we're going to have a few budget cycles before we get back to a safe spot, because criminal prosecution takes time, takes a long time. And so any person that's been involved in either any type of trial knows that this goes on for very long periods of time, especially when there's a massive amount of financial documents involved. So we need to find another way to keep our doors open and keep services available while we continue to advocate at the federal level. And the answer for that, or one of the answers, increase the state line item. Talk to your state lawmakers. We are talking to our state lawmakers every day. We have meetings tomorrow. We had meetings yesterday. We are asking for that amount to be increased to maintain the status of access across the counties that we have right now. And that, again, is not a full solution. That is how we keep our doors open while VOCA recuperates. So I know that I am running low on time. But like I said, we have incumbents that have already been educated on this issue multiple times, which is a great advantage when you're doing advocacy of this nature. So call your federal lawmakers. We're going to be creating resources now that the election results are in, and just make your voice heard and talk to people in your community, because we are not the only people that see this need. As Kristin said, everybody does, and everyone can write a letter of support to their lawmaker about increasing the funding.
Thank you. Kristin, Camille, thank you so much. Here at the Alliance, we do believe that there is strength and power in the collective, that our voices have power. So I thank you both for your time. And for those that are watching us today, and we'll continue to share the video for the survivors that are watching us, we want to let you know that indistinctively of the cuts, all of the 34 agencies within the state of Ohio that provide rape crisis services will continue to keep their doors open. Nobody will go ahead and be without service. It will be difficult, we do, but we believe you, we stand with you, and we are here because of you. So even in your most dire moment, when you feel that everything is lost, I want to remind you that in every corner in the state of Ohio, there are agencies that are here to support you. And you can also give us a call. For those of you that have discretionary funds to give, it's almost end of the year. Make your donations count. You have the ability. It is much more than COVID. It is actually a need. It has always existed, and it could be any of our loved ones. We cannot afford to go ahead and be without services, and any amount to any of your local agencies, or if you want to do it at a statewide level, makes a huge difference in advocacy, representation, in counseling services, and in just support. So once again, thank you, Kristin. Thank you for all the work that you are doing. Thank you for being also a regional leader in the Southwest region and a trailblazer. So we appreciate all that your agency and your staff does, and we shall continue to move forward.
Thank you so much for the opportunity. Appreciate you both.
Thank you.
All right, bye-bye.